Hey everyone, welcome back to another explainer. If you have ever felt your heart just pounding out of your chest, your mind racing a mile a minute, or even just that heavy, suffocating weight of anxiety sitting squarely on your shoulders, I want you to know you are absolutely not alone. In our fast-paced, modern world, chronic stress and anxiety, they've basically become an epidemic. We are constantly on the go, constantly connected, and just constantly stimulated.
But let me pose a quick question to you. What if you had an off switch for anxiety? Like, what if there was a powerful, natural tranquilizer for your nervous system that you actually carry with you at all times, every single second of the day? Well, that is exactly what the 4-7-8 breathing technique is. Today, we're breaking down this remarkable method to show you exactly how you can stop anxiety and panic right in their tracks. Okay, let's dive into this. Here's our roadmap for this explainer. First, we'll look at the anxiety off switch. Second, perfecting the posture. Third, executing the 4-7-8 breath. Fourth, the science of calm. And finally, applications and safe practice.
All right, kicking things off with Section 1, the anxiety off switch, from ancient origins to modern relief.
So, this method was popularized by Dr. Andrew Weil, and the fascinating thing about it is that it actually gets more effective the more you practice it. Think about it. Unlike prescription tranquilizers that might work beautifully on day one but kind of lose their punch over time, this technique is the exact opposite. And that's because it's deeply rooted in the ancient yogic tradition of pranayama, which is just Sanskrit for breath regulation. Specifically, it uses a practice called kumbhaka, meaning breath retention. So this isn't just about taking a quick, deep breath and moving on. It is a dedicated practice that fundamentally trains your body over time to default to a state of calm.
Which brings us to Section 2, perfecting the posture, setting up for success.
Before we even think about counting seconds, we really have to nail the physical mechanics. If you get the setup wrong, you're just going to miss out on the full clinical benefits here. Ideally, you want to perform this exercise sitting comfortably with your back completely straight. A straight spine is absolutely crucial because it allows your diaphragm to expand fully and freely, which pulls air deep down into the bottom of your lungs. Now, as a quick aside, if you're using this specifically to try and fall asleep, lying down perfectly flat in bed is completely fine too.
So here is the crucial point, the secret ingredient that almost everyone gets wrong. It's your tongue posture. Throughout the entire exercise, you must place the tip of your tongue against the alveolar ridge. That's the little tissue ridge right behind your upper front teeth. You literally lock it there, even when you're exhaling. This does a few things. It naturally encourages nasal breathing, it supports your upper jaw, and it creates a positive airway pressure when you exhale around the tongue. That's what creates this distinct whoosh sound that helps you empty your lungs completely.
Okay, Section 3, executing the 4-7-8 breath, the step-by-step guide.
Let's actually try this together. I want you to check your posture right now. Sit up nice and straight and place the tip of your tongue on that ridge right behind your teeth. Let's do a mini breath along. First, the setup. Part your lips slightly and exhale completely through your mouth. Make that audible whoosh sound around your tongue. Empty those lungs entirely. Okay, now close your mouth and inhale quietly through your nose for 1, 2, 3, 4. Now hold that breath gently, don't tense up, just retain it for 1, 2, 3, 4, 5, 6, 7. And finally, exhale completely through your mouth with a whoosh for 1, 2, 3, 4, 5, 6, 7, 8. And there you go, that is one perfect cycle. Now we reach my absolute favorite part, Section 4, the science of calm, why this actually works. Listen, this is not just some placebo effect. It is a profound biological override mediated by your autonomic nervous system. That's the system that handles all your body's involuntary functions, and it has two main branches. On one side, we have the sympathetic nervous system. This is your classic fight-or-flight mode. When you're stressed out, it floods you with adrenaline and cortisol, and your breathing becomes shallow and rapid, right up in your chest. On the other side is your parasympathetic nervous system, your rest and digest mode. The problem is chronic stress literally traps us in that sympathetic mode. We desperately need a way to flip the switch back to the rest and digest side.
And this brilliantly illustrates exactly how the 4-7-8 breath acts as a direct trigger for the main highway of your calming parasympathetic system, the vagus nerve. Because that 8-second exhale is exactly double the length of your 4-second inhale. A safety signal is instantly sent straight to your brain, which then releases acetylcholine. This neurotransmitter literally forces your heart rate to slow down and your blood pressure to drop. It's incredible.
But wait, what about that 7-second hold? You know, a lot of people mistakenly believe that deep breathing is just about sucking in as much oxygen as humanly possible.
But the real magic of that number 7 is actually all about carbon dioxide management. The science behind this breath retention is known as the Bohr effect. By holding your breath for 7 seconds, you're allowing a mild accumulation of CO2 in your bloodstream. This slight rise in CO2 lowers your blood's pH, making it just slightly more acidic. And paradoxically, this acidity is exactly what tells your red blood cells to release oxygen way more efficiently into your tissues and your brain. Plus, for anyone who suffers from panic attacks, this 7-second hold acts as a gentle sort of exposure therapy. It actually trains your overly sensitive chemoreceptors to tolerate normal CO2 fluctuations without hitting the panic button. And this physical shift, it also radically alters your brain's electrical activity. EEG studies actually show that this paced breathing shifts your brain away from those fast, chaotic beta waves that are associated with stress and increases your relaxed alpha and theta waves instead. It actively quiets the anterior insula, which is essentially your brain's threat detection center, while simultaneously causing a massive improvement in your heart rate variability. Basically, it makes your nervous system far more resilient and flexible.
Finally, let's look at Section 5, Applications and Safe Practice. How to use this safely.
Because this technique is just so highly effective at clearing out built-up cortisol and adrenaline from your bloodstream, the clinical applications are incredibly broad. Most famously, it acts as a natural braking system for a racing mind at night, making it a game changer for sleep and insomnia. But it's also utilized in medical settings to manage post-surgery anxiety and pain. It helps COPD patients manage shortness of breath, and doctors even prescribe it to stop these stress-induced inflammatory cascades that can cause severe eczema flare-ups.
But we do need to talk about some strict rules for best practice. Consistency is absolutely key here, so you should really aim to practice this twice a day. However, you must strictly limit yourself to a maximum of 4 breath cycles per session for your first month. Your body's neurological signaling actually needs time to adapt safely before you extend it to 8 cycles. Also, keep in mind that the 4-7-8 ratio is what really matters here, not struggling to hit the absolute perfect seconds. If you need to speed up your internal counting a bit, go for it, just keep the ratio intact.
Now, it is important to deliver a quick safety disclaimer here. When you first start doing this, you might feel a tiny bit lightheaded. Don't worry, that is completely normal and it will pass. Just make sure you sit or lie down while practicing. However, the prolonged breath hold isn't for absolutely everyone. If you have severe COPD, asthma, cardiovascular disease, or if you're pregnant, you really should consult a medical professional first. A simple, slow, diaphragmatic breath without the hold is a perfectly safe alternative if you fall into those categories.
And that brings us to the end of our explainer. The 4-7-8 technique is a scientifically backed tool to literally hijack your nervous system, balance out your blood gases, and slam the brakes on anxiety. So I want to leave you with a bit of a challenge. Try this twice a day for the next week. Do it once when you wake up and once right before you go to sleep. Ask yourself, how does your body respond when you finally use this newfound off switch for anxiety? Give it a shot. Until next time, stay focused and keep learning.